Hello and welcome to the Through the Pain podcast. This is a place for chronic pain and chronic illness warriors to dare, dance, and dream through the pain. Hello, everybody, and thank you for joining me on the Through the Pain podcast. This is part 2 of my interview with Dominique Friend. She's an author and a chronic illness warrior. If you by chance missed part 1, I suggest you go back to episode 6, part 1 of this interview. So we're going to go right back into it. So, Dominique, I have a question. Have you ever experienced healthcare bias by healthcare professionals?
Oh my goodness. Extremely. Yes. I have so many horror stories about that. But what I want to say to that is number one, we know our bodies better than anybody, and I understand docs went to school. They went to school for a basic understanding of how the body works. Yes, but individually, everybody is different. And I will say to that, definitely know your body, number one, and stand your ground when you're out, in the doctor's office and, having to sometimes have these disagreements with doctors. And to me, a lot of it have to do with their ego. And I've actually had a doctor say that to me. I was asking this one doctor who's been kind of like a colleague, and he's definitely up in age now, and he doesn't see patients anymore. He just, pretty much a consultant. And we were in a workshop, and I asked the question, why is it so hard for doctors to just take advice from us as the patients? And that particular doctor that I was talking to, he just came right out and said, some of us are very arrogant, and it's our ego that don't want to listen sometimes to the patient, thinking that we know more than what you do. Oh. And I couldn't believe he said it, but I was glad that he said it because that's the truth. That's exactly how his colleagues act. But when I get in situations like that, Dima, and sometimes it's very difficult when you're hurting and you're at your worst and you're trying to convince these docs what you know about your body, particularly about pain medication. Because if you're going into an ED or ER and they're telling you, they ask you, well, what works for you? What helps to bring you out of crisis? As soon as you tell them what pain medication or amount that you need, they automatically think you're a drug seeker because you know what you need. And I say to that, when they say those, when I'm in a situation where I'm trying to get them to hear me, what if you had a patient that came in that's diabetic? You would expect for that patient that's diabetic to know how much insulin they take to bring them out of whatever crisis situation that they may be in. So you would look at them weird if they didn't know the name of the medication and what it is. Unfortunately, we just deal with a disease that causes pain. And, because of the things that have going on in our world, with opioid crisis and all of the other things, it makes it difficult for us. But stand your ground. Advocate for yourself. If he's not listening, there's always somebody that's over him or is overseeing him or her that you can ask to speak to, because I've done it. I had to go as high as the administrator that's on call at the time, and sometimes it can get really crazy, and I've heard stories where patients are escorted out of the hospital, by police. But I would say to situations like that, and this is what we don't do, Damon, that we need to do more as warriors, when we encounter those situations, stand up for yourself, number one. Number two, if you cannot deal with get the situation dealt with at that time, when you get better, don't forget about it.
Right.
We need to complain because you need to write the letter to the president of that hospital. You need to make phone calls to the president of that hospital, or pick up the phone and call a fellow warrior and ask, how do I put in a complaint? Because if we went to a restaurant and we were getting bad service, we would not complain, right? We would expect, the first thing we will be wanting to know is, let me speak to your manager. We complain about those things and we put in complaints about things like that. But when it comes to our body and we're being mistreated, don't forget about that situation later. Put in the complaints. And that's what we don't do as boys. A lot of times, once we get out of it, we forget about it.
I think we do that because, one, I know I do that. I know I let it go sometimes because the pain is so overwhelming while I'm in the hospital. I'm just exhausted and I'm over it. I don't want to go through it. So by the time it happens again, I'm like, you guys keep doing it. It's like a Band-Aid being ripped off of an old wound. So I'm going to try to be a little bit more mindful. So thank you for sharing that advice.
Right. I mean, because hear me, I definitely understand what you're saying. That's why I'm saying when we get out, once we get better, and if we can, while we're going through little things that we remember, we always have our cell phones with us. Make a little note, of what you can remember while you're there. Or if you have a family member there, make some notes. That way, when you are better, revisit it. That's all I'm saying. We got to stop letting them get away with it. I don't expect for us to do things when we're in the middle of that crisis and when we, while we're sick, but definitely when we get better, we have to begin to stand up for ourselves and not let them get away with the poor treatment because we don't deserve that.
Absolutely.
So,
Dominique, thank you so much for joining me here today.
Okay. We can talk about this all day. Like, it's so crazy because, like, when we talk about sickle cell, we can go for hours about, our experiences and things that, we've been through and things that need to change. It can definitely be a heavy lift and such a burden, but I believe, doing what I do and even what you do as an advocate, that we have to continue to do what we do to help those that are coming up, the younger children that are living with this disease now. We're hoping for a cure soon, but at the same time, we don't want those young people to have to deal with what we had to deal with. We can change this.
Absolutely. Absolutely.
Yeah.
So this is going to be the end of our wonderful interview. I don't want it to but do you have anything else that you want to add for our listeners today?
I would just say, in spite of what you go through, live a life of purpose. Push, be persistent, persevere. It may take time, but consistency will definitely make a big difference. Consistency is important. So just push past what you feel and what you're going through. Persevere and remember your story is important and it can save somebody else's life.
Amen to that.
Amen. Amen. Thank you, Dima. Thank you so much for asking me, and I apologize for several times that I had to cut cancel. But you know what? I think that's important because people need to understand that sickle cell is very unpredictable. You don't know what's going to happen from hour to hour. I used to say from day to day. It's hour to hour.
Oh no, it's minute to minute.
Well, I was getting ready to say minute to minute. You right about that, Dean. Minute to minute, So we just have to continue to persevere past what what's going on. And that's what I really appreciate what you're doing. You are awesome and you have inspired me as well. Um, and I love you, Sister Warrior. And it's so crazy that we have not had a chance to meet or hug in person. Like, seem like we've been knowing each other. We have been knowing each other for years. It's like crazy.
I think, yeah, even before my second son was born, like that long. Like he's 8
Wow.
now.
Wow. That's right, because I remember you was pregnant, like in the pictures. Yeah. Oh, wow, Dame. I didn't even realize it's been that long.
Yes, it has been that long.
Girl.
We both mourned the passing of our dear friend who was with us in the beginning of early stages of setting the foundation for a lot of sickle cell work.
Right.
May he rest in peace.
Yes, definitely.
And yeah, that was very hard. That was very hard.
Extremely. Mm.
And then there was the passing of my friend Bobby Vines, who was an executive for the Boston Celtics.
Mm.
So he passed as well. And there's so many some sickle cell patients that has we've lost over this time.
Right. Yeah.
Completely devastating because it's so close to home.
Exactly.
It feels like we're going off to war sometimes.
Right.
Who's gonna come back home?
Right. That's exactly what it feels like, Dama. I definitely agree 100%. It can be so difficult, Oh my Lord. Because it's like literally, we are on the front line as soldiers in this war, in this battle for just fair treatment, And all I can remember, or all I try to remind myself is, how did Martin Luther King, do it? And all the other civil rights leaders, they came together. It was hard, but, we live a life now totally different because of what they did. And I just think about that, and that kind of helps motivate me to continue to do what we're doing, as warriors, to continue to be out there motivating and advocating for this disease. And, I was reading some of his speeches, and I learn a lot through watching movies. I'm such a movie buff. And I love watching movies. And I remember watching his movie and of his life and all the things that he went through, including his family. But one of the quotes in one of his speeches, he shares about health care, like inequality in health care is the most inhumane.
Oh, yes.
Shocking and the most, I'm not definitely not repeating it the way it is, but it's the most shocking and inhumane thing that you can go through, We
are seeing it now with COVID-19.
Yes.
We're seeing the health disparities on a whole nother level.
Right.
The people that are most effective and the people that have passed on are people who have like low income and like no access to healthcare and even quality food. I'm also noticing people that are exercising that have COVID-19, either exercising, having a balanced diet, has access to herbs and medicine, they're surviving. Whereas people that don't have access to that are not surviving.
Right.
It's kind of in your face right now.
It is.
Right.
It really is. And somebody had put a quote up on Facebook about um, how people, like they were saying something to the degree in what, like us, how, how people are saying like essential people that you have a job, only the essential employees or whatever can come in.
Yep.
And we're talking about how, like, our healthcare workers, teachers, people like that, like, why is it that, these are really essential employees, especially the first responders and healthcare workers? Like, if they are essential, why is it that they get paid drastically lower than an athlete or a celebrity?
Right.
And that's what I was saying, like, okay, our life right now depends on our healthcare workers, but you will pay a basketball player millions of dollars, to do what they do. It really made me think, because they were so right. Like, what?
Right.
So right. This is the last thing I'm gonna share, Dima. Did you hear about the story of the bus driver in Detroit?
Oh no.
It was a bus driver. He had put a post up, bus driver for mass transportation. And he has stated that a woman had got on his bus, because they're still out trying to do their jobs to help you get around and do, what we need to do. And he said some woman got on his bus, and with all this going on, just was standing, while she trying to put the money in, I guess, coughing.
Oh God.
Right there in his face, just coughing. And he put that post up. 3 days after that post, he died from coronavirus. Like, he caught they were showing it on CNN, and the Detroit, I believe he was the mayor, that was just, showing it and talking about it. And that was so crazy. Like, wow. Here again, you got a certain amount of people that are out here doing their job. That's just like going into the emergency room now and sneezing on the nurse without covering your mouth or your, like, first of all, who does that? You just coughing on people? Like, that was crazy. That thing was so shocked. That just hit me, in my heart, because he was just so intense in telling the story, and to come and find out later that that man actually got the virus and wound up dying from it.
Wow.
It was crazy. And it wasn't like he was old. I say he was kind of like middle age. But yeah, that was just crazy. Crazy. But I'm not going to hold you up, Dana. Thank you so much.
Thank you. So I enjoyed every minute. I'm going to.
I did as well.
If I have to cut this up in 2 parts, I will cut it up in 2 parts, because I
Okay.
every single second of our conversation. I
Oh,
learn
okay.
from you every time we have a discussion. Please keep doing what you're doing. Let's do a better job of staying in touch.
Yes,
I do
definitely.
want to partner with you, and after this whole monstrosity of the COVID. For tools, merchandise, and additional information, log on to our website, www.throughthepain.org. This has been a Public Praise Media production.